Hello, my name is Jonathan Nguyen, and today I'm going to be talking about the ethics of conversion therapy. Conversion therapy is a therapeutic technique that strives to change or suppress an individual's expression of sexual orientation or gender identity. Conversion therapy is a unethical and outdated method or technique that tries to convert a homosexual to that of the societal norm, heterosexual. Ethical consent can only be obtained when a patient is informed about all the advantages and disadvantages of a treatment. Many minors cannot ethically consent as they may be coerced into this treatment. Some adults seek out this treatment, however, due to outside pressure, it is questionable how autonomous their decision actually is. Many people that have gone through conversion therapy were physically harmed, forced to conform, and believed that homosexuality was unnatural and a sin. Due to the fact that these methods were cruel, many health organizations have come out and spoken out against these practices as unethical and should be banned. Although there are many non-physical methods of this technique, many consequences of this technique include suicidal ideation, anxiety, depression, and post-traumatic stress disorder. In this video, I will be talking about the harm and ethics of conversion therapy and how this technique has been proven ineffective. As of today, many people are identifying as something other than heterosexual. However, in the past, many people looked down upon homosexuality, and at one point it was considered a mental illness and a sin. A new generation of people who no longer identify as gay or lesbian, but as queer, are establishing a more diverse and fluid picture of sexual orientation than it has been in the past. Today, queer children are lacking the vocabulary and guidance that supports them for who they say they are in terms of their identity. Parents today need to learn how to nurture and accept and love their children for who they say they are. In a study that was done, it showed that acceptance from one's family predicted higher self-esteem, social support, and overall health, and also protected them from depression, substance misuse, and suicidal ideation and behavior. When parents are not accepting of their children's identity and force them to go through conversion therapy, this can be physically and mentally damaging and harming to the child. Conversion therapy is an outdated method that has shown more negative effects than it has positive effects. Conversion therapy is an umbrella phrase that refers to a wide range of procedures and methods for changing or suppressing a person's sexuality or gender identity. Physical methods of this therapy have included corrective rape and sexual assault, imprisonment and kidnapping, physical abuse, electroconvulsive shock treatments, hormone treatments, and aversion therapy. However, not all methods of conversion therapy inflict harm. For example, non-physical methods may involve talking therapy such as psychotherapy, peer support, or pastoral counseling, which are on the other end of the spectrum. Although these methods are non-physical, there is substantial evidence that using psychotherapy and pastoral counseling can lead to lifelong consequences such as loss of self-esteem, anxiety, depression, social isolation, intimacy difficulty, self-hatred, sexual dysfunction, suicidal ideation, and post-traumatic stress disorder. In 1899, at a hypnosis conference in Germany, a German psychiatrist captivated the audience with a startling claim. He had turned a homosexual man heterosexual. Albert Notzing had boasted that all he needed was 45 hypnosis sessions and a few excursions to a brothel. He had stated that his hypnosis had influenced a man's sexual desires, causing them to shift away from his interest in men towards a lasting passion for women. Although he may have not realized it, he had created a trend known today as conversion therapy, a series of pseudoscientific procedures aimed at suppressing LGBTQ people's sexuality and forcing them to conform to that of society's expectations of how they should behave. Conversion therapy was widely conducted throughout the 20th century, leaving shame, pain, and self-hatred in its wake despite medical establishment's dismissals. In the 19th century, homosexuality was considered a sin and looked down upon. Many doctors and psychiatrists began looking for ways to reverse this. They began coming up with questions and reasons as to why people were homosexual. One theory that was proposed was by Eugen Steinig, a pioneering Austrian and endocrinologist who believed that homosexuality was anchored in a man's testicles. In the 1920s, this led to testicle transplantation experiments in which a gay individual was castrated and given heterosexual testicles. Another theory that was proposed was by Sigmund Freud, who believed that humans were innately bisexual and that homosexuality was due to conditioning. Although he did not believe homosexuality was a sickness, his colleagues disagreed. In an attempt to cure gay persons, they began to apply new psychological therapies. Many of these patients were subjected to cruel punishments such as the electric chair and lobotomies. An extension of these techniques are aversion treatments, which was founded on the notion that if LGBTQ persons were disgusted by homosexuality, they would no longer experience same-sex desires. For example, people were given drugs under medical supervision where they would vomit if they were to look at an image of their significant other. Today, these practices are now outdated and are banned in some countries and states. Due to the amount of evidence that conversion therapies are ineffective and may harm patients and their families who refuse to change, mental health organizations have condemned these techniques. California, Illinois, New Jersey, Washington, D.C., Oregon, and the Canadian province of Ontario all passed laws prohibiting minors from receiving conversion therapy. And there is a growing number of U.S. states that are considering similar legislation. Similarly, in April of 2015, the Obama administration called for a ban on conversion therapy for minors. Many professional organizations, such as the American Psychological Association, American Psychiatric Association, and the American Academy of Child and Adolescent Psychiatrists, have conducted peer-reviewed literature reviews and have found no evidence that conversion therapy treatments have resulted in any change in sexual orientation. However, there is evidence that these treatments are detrimental. The lack of competence among conversion therapy practitioners is a fundamental ethical flaw. Competence in terms of medical ethics is defined as the capacity to display up-to-date scientific studies and professional information, as well as the need for continuous education on the efficacy of treatment. Homosexuality was considered a mental disorder until 1973. However, medical professions still utilize the outdated practice of conversion therapy. Conversion therapy is opposed by ethicists for two reasons. One, it is a remedy for a condition that has been defined not to be a disease. Two, it perpetuates a bias in devaluation of homosexuality, an unjustified devaluation of homosexuality. Conversion therapy does not follow the principle of beneficence because the benefits do not outweigh the harm. Informed consent can only be obtained when a patient is informed of all the advantages and disadvantages of a treatment. Without this information, real consent cannot be obtained. Therefore, it would be a coercive procedure. There are many ethical violations in these treatments, such as subjective informed consent by leading patients to believe that homosexuality is a mental disorder, and breaching of confidentiality in a religious setting where a counselor may openly discuss the beliefs of a patient's wrongdoings. Some may also be improperly pressuring patients by threatening to end treatment if they do not subject to authority, or abandoning patients when conversion therapy is failing and are unwilling to send patients to an affirmative therapist. Lastly, regardless of the probability of success, some may still practice and recommend their treatments to anyone, or may resort to patient blaming when conversion therapy is not working, rather than reflect on the skill and efficacy of this treatment. Shown that conversion therapy has proven little effectiveness and only creates more space for harm. If a medical professional practices conversion therapy, they should be legally accountable for disregarding medical ethics. Conversion therapy has shown to be more harmful than it has been helpful. Many patients that have gone through conversion therapy have experienced a number of negative drawbacks due to the amount of harm that has been inflicted on them through this method. According to existing studies, conversion therapy is linked to a number of negative drawbacks and effects on LGBTQ clients, including depressive symptoms, suicidal ideation and attempts, social isolation, and low self-worth. Due to the amount of documented harm that has been associated with conversion therapy, a number of mental health organizations have adopted declarations and/or rules questioning the ethics and practices of conversion therapy. In another study that was done, men who were exposed to conversion therapy had 2 to 2.5 times the likelihood of reporting 1 in 2 psychosocial problems. Participants who believe in the ethical character of conversion treatment and/or practice conversion therapy have significantly lower competence working with LGBTQ clients and have significantly higher unfavorable beliefs toward LGBTQ people. Therapists with biased views towards members of the LGBTQ community may be violating rules where harm to the patients may be a concern. Some proponents of conversion therapy suggest that it is the responsibility of practitioners to provide conversion therapy if a patient requests it. If a patient agrees to conversion therapy, it is most likely due to the intense pressure from their family, religion, or the social environment, which creates doubts about how autonomous their decision actually is. In some religions, homosexuality is not accepted. Therefore, individuals who are very religious may want to seek change due to their beliefs. Internalized homophobia is the most common reason for why individuals seek conversion therapy, due to adhere to society's heteronormative expectations. In a study of 76 women and 113 men seeking conversion therapy, internalized homonegativity fully mediated the associations between religious orientation and the propensity to seek conversion therapy. A patient may request a procedure that brings some benefits, but if the risks outweigh the advantages, then the practitioner is not morally entitled to perform it. A more ethical approach for therapists would be to explore and understand the motivation behind why individuals seek conversion therapy. After understanding more, therapists should take an affirmative approach and assist the patients with self-care and self-acceptance to help them understand that homosexuality is not a condition that needs to be changed. This would include helping the patient adjust to and embrace their identity and desires, confront their internalized negative views of homosexuality, and explore what full acceptance of themselves will look like in their lives. So in conclusion, conversion therapy is a non-proven, unethical attempt to try and change or suppress an individual's sexuality. While it has been widely used in the past, it is no longer viewed as ethical and has found no evidence that treatments have shown to result in any changes in sexual orientation. Techniques, whether physical or non-physical, have shown to result in anxiety, depression, suicide, and post-traumatic stress disorder. It is unethical due to treating homosexuality as a condition when it is no longer considered a mental illness, and because it perpetuates a biased and unjustified view of homosexuality. When families are supportive and accepting of their loved ones and see no need for them to change, an individual can have higher self-esteem, overall better health, and protection from anxiety, depression, suicidal ideation, and substance abuse. When a therapist is approached by a patient who is seeking to change for their behavior, a therapist should approach a patient with an affirmative approach and to fully help them accept themselves. This can be done by teaching patients self-care and rethinking negative stereotypes and internalized homophobia. Thank you.